Today I will talk about the humerus bone. It is the longest bone of the upper limb. It is divided into three parts: an upper end, a shaft, and a lower end. The upper end articulates with the glenoid cavity of the scapula bone and it forms the glenohumeral joint. The lower end articulates with the radius and the ulna and it forms the elbow joint. Let's see how the bone is held in its anatomical position. In order to hold the bone in its anatomical position, the head must be directed upwards, medially and backwards, like this. The lesser tubercle must be directed anteriorly, like this. The flat end of the bone must be placed downwards, with its medial epicondyle being directed backwards slightly. Now that we know how to determine the side of the bone, let's move on to its bony features. The head of the humerus is 1/3 of a sphere, and it is marked by an anatomical neck surrounding the head. The second neck of the humerus is present beneath the anatomical neck, and it is an imaginary line which is surrounded by the axillary nerve and the posterior circumflex humeral vessels. 0.5 centimeters below, there is the morphological neck of the humerus. The morphological neck is the junction between the diaphysis and the epiphysis of the bone, also known as the epiphyseal line. The upper end of the humerus bone has two tubercles, the lesser tubercle and the greater tubercle. The greater tubercle has three impressions: an upper impression, a middle impression, and a lower impression. Between these two tubercles, we have the intertubercular sulcus, or the bicipital groove. Through this, the long head of the bicep brachii passes. The bicipital groove has three parts: a medial lip, a lateral lip, and a floor. Moving on to the shaft of the humerus. The shaft of the humerus is divided into two parts: a upper half and a lower half. The upper half is more cylindrical and the lower half is more triangular. Both of them have three surfaces and three borders, but on the lower half, the three borders are more visible because it's triangular. This is the anterior border of the shaft, this is the medial border, and this is the lateral border. Between the anterior border and the lateral border, we have the anterolateral surface. Between the anterior border and the medial border, we have the anteromedial surface. And between the lateral and the medial border, we have the posterior surface. The anterolateral surface has a V-shaped tuberosity, also known as the deltoid tuberosity. Here the deltoid muscle attaches. The middle 1/3 of the posterior surface has a groove known as the spiral groove or the radial groove. Through this groove, the radial nerve passes, along with the profunda brachii artery. Moving on to the lower end of the humerus. Here we see two epicondyles, the medial epicondyle and the lateral epicondyle. The medial epicondyle is more prominent than the lateral epicondyle. Above the medial epicondyle, there's a ridge known as the medial supracondylar ridge. It continues with the medial border of the bone. Now, there's a similar ridge on top of the lateral epicondyle. It is the lateral supracondylar ridge. It also continues with the lateral border. This rounded structure is the capitulum, which articulates with the radius bone. This is the trochlea, which is a pulley-shaped structure. It articulates with the ulna bone, the trochlear notch on the ulna bone. The medial part of the trochlea projects 0.6 centimeters below the lateral part of the trochlea. This results in the carrying angle. Above the anterior aspect of the trochlea, we have the coronoid fossa. Here, the coronoid process of the ulna is accommodated when the elbow joint is flexed. Above the anterior aspect of the capitulum, we have the radial fossa. The radius head is accommodated when the elbow joint is flexed. Above the posterior aspect of the trochlea, we have the olecranon fossa. The olecranon process of the ulna is accommodated here when the elbow joint is extended.